So this is week 6, but on your paper it's going to say week 8, and it's the vascular tray. First we have curved bulldogs. Curved. These are for clamping and occluding vessels in the body temporarily. They're counted. And we have the right angle 12-inch clamp. It's much bigger than the other right angle. This is used in AAAs, and it clamps vessels. Then we have the straight bulldog clamps, used for the same thing the curved are for. These are atraumatic, by the way, because you want those vessels to still work once you let them go. Then we have the mixture right angle. So obviously this is smaller than the regular right angle. This is for AV shunts, used to dissect tissue. Also, it's used for fistulas. And then we have the micro right angle, which is very small. This one is obviously for more delicate tissue than the mixture, and this is broken. Remember that. That's supposed to match that side. It's damaged. Then we have the Pennington long clamp. This is a triangle. We were discussing that the lungs are basically like rounded triangles, I guess. So just remember, Pennington lung clamp. Pennington is the last name of somebody that we learned before, I think. Should have learned, I guess. Then we have the Gerald forceps, kind of indents more right here, which is a little bit weird to me. So I'm kind of like, okay, Jared, you're a weird little guy. And then there's this little stinger right there and a hole that it goes through. Why? I don't know. But Gerald is used for delicate tissue. Then we have hemoclip, the short medium hemoclip applier. Medium is blue. It's a short, I forget what this is called in the shaft, short shaft. So that obviously is for clamping. And then we have the micro hemoclip applier, and that's red, and it's just micro. That's it, the end. Then we have the Castro Viejo needle holder. So that's a Spanish name, and this is gold right here. So I guess if you think about the Hispanic culture, likes a lot of jewelry. And also that's a really long, weird name, and this is a really weird needle holder. Fun fact, the end is magnetic, and you squeeze it to clamp it closed, and then you just squeeze it again to open it. And you load Prolene onto this, Prolene suture. Sizes 6, 7, and 8 in the Prolene are the most common. Then we have the Ryder French eye needle holder. We have another kind of, I think this tip is a little bit weird from the other needle holders that we've already learned. Trying to think of something else definite about it. I can't. So then we have the narrow, deep Richardson retractor, which looks exactly like the other Richardsons. It's basically a baby, but just longer. So narrow because it's skinny, and it can go deep because you're looking for veins that are a little bit deeper. Then we have the Cushing vein retractor. Hole right here, tiny little edge right there. For some reason in my head, I feel like this is a tiny cushion. Like if this was fluffy and it was a pillow, like, oh, a little cushion. I don't know why my brain works like that. But you can also use this in general procedures. Then we have, this is a Pottsmith, or 125 degree Pottsmith scissor, which is a weird degree, and this is a weird looking scissor. You squeeze it, and that is what makes it cut. You see. And it's just like the Castro Viejo in the fact that it is weird. And it's connected together at the end, and I don't really like it. Okay, so 15. This is the 45 degree Pottsmith scissor. This is a 45 degree angle. So that's pretty plain and simple. Just remember Pottsmith. Like Potts is like your grandma's name. For some reason everybody calls her Potts, and her last name's Smith, and everybody just calls her Pot Smith, and she makes really good cookies. This is the 90 degree Pottsmith scissor. 90 degrees. So, 125, 45, 90. Super weird 125. Okay, 45, kind of more normal. And then this 90 degree Pottsmith looks like a very alert bird. So then this is a pediatric yank hour, obviously used for suction. This tip is typically soldered on. Sometimes you can disconnect these two pieces right here, right there. Or it comes disconnected and you have to put it together. And then this little baby is a suture tag. There are no serrations on the inside at all. This is completely smooth, super duper atraumatic, but it doesn't go on anything of the body, so that doesn't matter much. I mean, it doesn't damage the suture. So this clamps onto Prolene suture, which is very, very fine suture to begin with, that you don't want to damage. So that is it.